Okay, good morning to all. Myself Padma, working as Associate Professor in A.M. Reddy Memorial College of Pharmacy. Today my topic is sedatives and hypnotics. First of all, what is the definition for sedatives? Sedatives are the central nervous system depressant drugs that reduce the excitement, tension, and produce relaxation. Hypnotics are the drugs that depress the CNS and produce the sleep similar to that of natural sleep. So that is the main difference between sedatives and hypnotics. Both sedatives and hypnotics action may reside in the same drug. Next, coming to the next one. So in that topic, we have to discuss about the benzodiazepines, barbiturates, miscellaneous. So under that benzodiazepines, SAR of benzodiazepines, chlordiazepoxide, diazepam, oxazepam, florazepam, lorazepam, alprazolam, zolpidem. In this barbiturates, we will discuss about the SAR of barbital, phenobarbital, mefobarbital, emobarbital, butabarbital, pentobarbital, secobarbital. Next, miscellaneous under the amides and imides. Example is glutatione. Next, coming to the alcohols and their carbamide derivatives. Example is meprobamate. Next, coming to the classification. So in that classification, first one is benzodiazepines. Examples are chlordiazepoxides. Next one is barbiturates under that barbital. Next, acyclic hypnotic containing drugs, meprobamate. This is about the classification. Next, coming to the mechanism of action. In that benzodiazepines receptors are present in the brain and they form a part of GABA A receptors ion in the channels. Next, coming to the next one. These are all the structures of benzodiazepine. So in that benzodiazepine structure, we have benzene ring fused with the 7-membered ring system along with the 2 nitrogens present at 1/4 positions. So that is the general structure of benzodiazepine. So in that we have number of examples. In that sedatives and hypnotics, benzodiazepines and benzodiazepines. So in that examples are diazepam, oxazepam, lorazepam. So these are all the structures of diazepam, oxazepam, lorazepam. So this is the general structure for benzodiazepine. Next, coming to the next one. These are all the structures of benzodiazepines. So next, coming to the uses of benzodiazepines. Benzodiazepines, the symptomatic relief of tension and anxiety, acute alcohol withdrawal. These are all the uses. Next, adjacent therapy in skeletal muscle spasm and management of status epilepticus. The long-term use, physical dependence, small dose. Next, coming to the metabolism of benzodiazepines. So in that compounds without the hydroxyl groups are non-polar and undergoes hepatic oxidation. Next, coming to the compounds with hydroxyl groups have more polarity and are readily converted into the glucuronide conjugates and excreted easily. These compounds are also metabolized by 3-hydroxylation of benzodiazepine ring. Next, coming to the next one, in that metabolism of benzodiazepines. So in that nordiazepam is converted to oxazepam. Next, coming to the structure of chlordiazepoxide. So in that chlordiazepoxide structure, benzodiazepine is the basic nucleus. Engineering fused with the 7-membered ring system along with the 2 nitrogens present at 1/4 positions. At the 5th position, we have phenyl ring. At 6th, 7th position, we have chlorine. Okay. So what is the IUPAC name for this chlordiazepoxide? 7-chloro-5-phenyl, 2-methylamino, 1,4 benzodiazepine, 4-oxide. So next, coming to the what are the adverse reactions include drowsiness, ataxia, confusion. So these are all the uses for chlordiazepoxides. Next, it is used for the relief of anxiety and tension, withdrawal symptoms of acute alcoholism, and also used as sedative and also as well as muscle relaxant. Next, coming to the chloragipate. This is another drug. So this is the structure of chloragipate. So in that chloragipate structure also benzodiazepine is the basic nucleus. At the fifth position phenyl ring is present. At seventh position Cl is present. At second position C double bond group is nothing but carbonyl group is present. At third position COOH group is present. So this is the structure of chloragipate. So what is the IUPAC name for this? 7-chloro-2-oxo-5-phenyl 1,4 benzodiazepine 3 carboxylic acid. So that is the IUPAC name for chloragipate. So it is an water soluble benzodiazepine derivative effective in the treatment of anxiety. It has also muscle relaxant and anticonvulsant actions. Next, coming to the diazepam. This is a very important drug in this. So in that diazepam structure also benzodiazepine is the basic nucleus. Already you know that benzene ring fused with 7-membered ring system along with the 2 nitrogens present at 1/4 positions. At first position nitrogen attached with methyl group. At second position C double bond group. In between fourth and fifth position unsaturated bond is present. At fifth position phenyl ring is present. It's nothing but C6H5. At seventh position Cl is present. So this is the structure of diazepam. What is the IUPAC name for this? 7-chloro-1-methyl-5-phenyl 1,4 benzodiazepine 2-one. Actually, these two are the another names for diazepam, Compos and Valium. So these two are the another names for diazepam. So what is the use of diazepam? It is used as skeletal muscle relaxant, anticonvulsant, and anti-anxiety agent. Next, patients on the drugs should be cautioned not to drive an automobile or to operate dangerous machinery until a few days after the drug has been discontinued. Next, coming to the next one, oxazepam. So in that oxazepam, benzodiazepine is the basic nucleus. At first position, hydrogen is present. Second position, C double bond group is present. At third position, hydroxy group is present. In between fourth and fifth position, unsaturated bond is present. At fifth position, phenyl ring is present. At seventh position, Cl is present. So this is the structure of oxazepam. So what is the IUPAC name for this? 7-chloro-3-hydroxy-5-phenyl 1,4 benzodiazepine 2-one. 2-one means at second position C double bond group is present. So that's why we are called 2-one. So next, coming to the use. What is the use of oxazepam? It is useful for the control of acute tremulousness, anxiety associated with alcohol withdrawal. So next, coming to the adverse effects is nothing but side effects that have been observed include rashes, nausea, lethargy. Next, coming to the next one is lorazepam. So in that lorazepam also we have benzodiazepine is the basic nucleus. So this is the structure of benzodiazepine. At second position, CW1 group is present. At third position, hydroxy group is present. In between fourth and fifth position, unsaturated bond. At fifth position, phenyl ring attached with Cl. So that's why we are called this is an chlorophenyl. This is the structure of chlorophenyl. Next, at seventh position, Cl is present. So that's why what is the IUPAC name for this? 7-chloro-5, 2-chlorophenyl. 2-chlorophenyl means this is the structure of chlorophenyl. 3-hydroxy. At third position, hydroxy group is present. 1,4 benzodiazepine 2-one. 2-one means due to the presence of C double bond group in that structure. Next, coming to the uses. It is used as sedative and hypnotic. It has much more polarity than diazepam. Duration of action is short. Next, coming to the one more important drug is alprazolam. So in that alprazolam structure, we have benzodiazepine is the basic nucleus. But at the first and second position, we have triazole group. Triazole means it is a 5-membered ring system along with the 3 nitrogens present in that structure. So that's why we are called, this is the structure of triazole. Azo means nitrogen. So next, at fourth, in between fourth and fifth position, we have, in between fourth and fifth position, we have unsaturated bond. At fifth position, phenyl ring attached with R. R means we are substituting with either hydrogens or methyl or ethyl or propyl. But in case of alprazolam structure, we have to substitute with the methyl group. At seventh position, Cl is present. So this is the structure of alprazolam. So what is the IUPAC name for this? 8-fluoro, 1-methyl, 6-phenyl, 4-H trizolo, benzodiazepine. Trizolo means already you know that we have 3 nitrogens present in the structure. So next, coming to the metabolism. What is the metabolism of alprazolam? The methyl group of this drug is metabolized by oxidation reaction to methyl alcohol and conjugation reaction takes place. Next, it is useful in the short-term management of insomnia due to lack of sleep. So that is the definition, that is the meaning for insomnia. Next, coming to the non-benzodiazepines. In this non-benzodiazepines, one of the example is zolpidem. So zolpidem comes under the non-benzodiazepines. So in that, benzodiazepine basic nucleus is absent. So that's why we are called, these are the non-benzodiazepines. So in this zolpidem structure, we have benzene fused with imidazole. Imidazole means already you know that in that structure, it is an 5-membered ring along with the 2 nitrogens present at 1/3 positions. So actually this is the structure of benzimidazole. Again, this one is connected with C6H5, is nothing but phenyl. This one is connected with methyl group. So actually this one is also called as toluene or methylbenzene. Okay. So this one is connected with side chain CH2CO and CH3 twice. Is nothing but what is the dimethyl 2,6-methyl. Dimethyl 2,6-methyl amide. So at this position we have methyl. So already you know that numbering starts from here only. 1, 2, 3, 4. 1, 2, 3, 4, 5. Okay. So this is the structure of zolpidem. So this is the IUPAC name for zolpidem. N-dimethyl 2,6-methyl 2,4 methyl phenyl imidazopyridine 2,3-il acetamide. Acetamide means we have CH2CONH group is present. Acetyl group means is nothing but CH3CO group along with amide means NH2. H replaced by methyl group. Okay. So this is the structure of zolpidem. So it is an imidazopyridine agent. It is an agonist at the benzodiazepine alpha-1 receptor, subunit of the alpha-A receptor used for the management of insomnia. So this is the numbering for zolpidem structure. Next, coming to the SAR. SAR means already you know that structure activity relationship. So in that SAR, so first of all, we have to discuss about the general structure for benzodiazepine. Already you know that benzene fused with the 7-membered ring system at 1/4 positions, 2 nitrogens presents. At first position, R1 group is present. At second position, C double bond group is present. In between fourth and fifth position, unsaturated bond is present. At fifth position, phenyl ring is present. At seventh position, R7 group is present. So this is the general structure for benzodiazepine. So the presence of electron attracting substituents like Cl, chlorine, fluorine, bromine, nitro at position 7, C7 is required for the activity. At 7th position, we have to substitute it with the chlorine, fluorine, bromine. So automatically this one having more active. Next, coming to the position 689. 689. This is an 6th position. This is an 8th position. This is an 9th position. Should be unsubstituted for the activity. Next, coming to the phenyl or pyridyl. Pyridyl means already you know that pyridine means benzene ring attached with N heteroatom. Okay. Phenyl or pyridyl at the C5 portion. C5 portion promotes the activity. If the phenyl ring substituted with electron attracting groups at 2 dash, 2 dash or 6 dash positions, then the activity is increased. Substituents at 3 dash, 4 dash and 5 dash decreases the activity. Next, coming to the saturation of 4, 5 double bonds or shift of it to the 3/4 positions decreases the activity. Is nothing but due to the shifting of this double bond in between these two, automatically it decreases its activity. Next, alkyl substitution at position 3 decreases the activity. When we are substituting with alkyl group at third position, automatically it decreases its activity. But the presence or absence of this group, automatically it decreases this activity. Next, coming to these are all the examples for benzodiazepines. Already you know that what are the examples for this. Next, this is about the SAR. Next, coming to the diazepam synthesis. Diazepam, this one is very, very important drug. So, how to synthesize diazepam? So, in that synthesis, this is the starting structure, 4-chloroaniline. Aniline means already you know that benzene ring attached with NH2 group. Okay. So, this is the structure of aniline at fourth position. Fourth means is nothing but para position. We have Cl group is present. So that's why we are called this is the structure of 4-chloroaniline. This one is treated with benzoyl chloride. Benzoyl chloride means benzene ring attached with C double bond O. Actually, that is the structure of benzoyl along with addition of Cl. So that's why we are called benzoyl chloride. Okay. 4-chloroaniline is combined with or is condensed with benzoyl chloride. So this reaction is carried out in presence of Lewis acid. It acts as a catalyst in presence of zinc chloride. So that's why it undergoes Friedel-Crafts acylation reaction. So that's why we have to get the next structure like this. Okay, aniline attached with Cl. In between C double bond O group is present. Again, addition of C6H5 is nothing but due to removal of Cl in this structure. Next, again, when we, so what is the structure name? This is an benzophenone derivative. Okay, again, when we are treating with chloroacetyl chloride, this is the structure of chloroacetyl chloride, Cl, CH2, CO, Cl. So that's why we have to get the reactive intermediate, one more reactive intermediate. So this is an ring opening structure. Again, further it undergoes cyclization in presence of NH3. So it gives an benzodiazepine skeleton. So this is the structure of not diazepam. Again, this one is treated with methyl iodide in presence of DMF. DMF means dimethyl formamide. So finally it gives an diazepam. So this is about the synthesis of diazepam. Next, coming to the barbiturates. So in that barbiturates, this is the mode of action for barbiturates. Barbiturates primarily act on GABA benzodiazepine receptors, Cl channel complex, and potentiate GABAergic inhibitory action by increasing the lifetime of Cl minus is nothing but chloride ions channels opening induced by GABA. Next, coming to the barbiturates do not bind to benzodiazepine receptors, but it binds to only alpha and beta subunits. Next, coming to the next one, barbiturates are the derivatives of barbituric acids. Their hypnotic activity is conferred by the replacement of hydrogen atom attached to the C5 position by aryl or alkyl radicals. Next, this is about the classification of barbiturates. Next, barbiturates classified on the basis of duration of their action. So under that we have different types. First one is long-acting barbiturates. Second one is intermediate-acting barbiturates. Next, third one is short-acting barbiturates. Next, fourth one is ultra-short-acting barbiturates. So these are all the types of barbiturates. So under that long-acting barbiturates, the duration time is 6 hours or more than 6 hours. So that's why we are called, these are the long-acting barbiturates. Next, coming to the intermediate acting barbiturates, that duration time between 3 to 6 hours. So that's why we are called, these are considered as an intermediate acting barbiturates. Next, coming to the short acting barbiturates, the duration time less than 3 hours. So that's why these barbiturates are considered as an short acting barbiturates. Next, coming to the ultra short acting barbiturates, the duration time 15 minutes. Okay, so that's why these are all the types of barbiturates. So under that, we'll discuss about the barbital, phenobarbital, methylbarbital. So these are all comes under the long-acting barbiturates. Next, under that intermediate acting barbiturates, examples are emobarbital and butabarbital. Next, coming to the short-acting barbiturates, under that examples are pentobarbital and secobarbital. Next, finally, ultra-short-acting barbiturates, under that one of the example is thiopental sodium. So this is about the classification of barbiturates. Next, coming to the barbiturates. Actually, barbiturates, under that one of the important drug is barbital or barbitone. Both barbital and barbitone. Barbital sodium and barbitone sodium both are same. These two are available in ketone or tautomerism. So that's why we are called barbital or barbitone. Barbital means due to the presence of hydroxy group in that structure. So that's why we are called barbital. In case of C double bond, in case C double bond O group is nothing but ketone group is present. So that's why we are called, that is the structure of barbitone. So that is the main difference between barbitone and barbital. Both are same. So this is the general structure for barbituric acid, is nothing but barbital sodium. Okay. It is an 6-membered ring along with the 2 nitrogens present at 1/3 positions. At second and fourth positions, we have C double bond O groups. Along with the 6th position also, we have C double bond O group is present. At 5th position, diethyl group is present. Diethyl. One along with Na plus is present. That's why we are called, this is the structure of barbital sodium. So it is available in salt form. So that's why both positive and negative charges, both are available in that structure of barbital. All of you understand this one? So next, coming to the, what is the IUPAC name for this? Sodium 5,5 diethyl barbitone. Barbitone sodium forms water-soluble salts with sodium hydroxide. It is a powerful hypnotic drug and is used in the treatment of epileptic seizures. So, this is about the synthesis of barbital or barbituric acid. Okay. Next, coming to the synthesis of barbital sodium. So, in that synthesis, starting structure is urea. Urea means already you know that C double bond O NH2 NH2 group is present in the structure of urea. This one is treated with diethyl 2,2 diethyl malonate. So this is the structure of diethyl 2,2 diethyl malonate. This reaction is carried out in presence of sodium ethoxide in presence of ethyl bromide due to removal of 2 molecules of ethyl alcohol, which upon condensation and cyclization, it gives an cyclic structure, that is barbitone. Okay, barbitone means already you know that it is an 6-membered ring at 1/3 positions 2 nitrogens, at 2, 4, 6th positions we have 3 C double bond O groups. Okay, that is the structure of barbitone. Again, we are reading with NaOH, so that's why we have to get the barbital sodium. So this is about the synthesis of barbital sodium. Next, coming to the phenobarbital or phenobarbitone. Next, in that phenobarbital structure, we have, so this is the structure of phenobarbital. At 5th positions, we have 1 ethyl group and 1 more phenyl group is present. So that's why we are called, this is an phenobarbital. What is the IUPAC name for this 5-ethyl 5-phenyl barbituric acid? So, phenobarbital sodium is a hygroscopic substance. It is used as sedative, hypnotic, and anti-epileptic drug. An overdose of it can result in coma, severe respiratory depression, hypotension, leading to cardiovascular collapse and renal failure. Next, coming to the next one, methylphenobarbital or mephobarbital. Both are same. So in that structure also barbituric acid is present. So at fifth position, one ethyl group and one more phenyl group is present. One hydrogen replaced by methyl group. Methyl means due to the presence of methyl group in that structure. Okay, this is an important in the structure of methyl phenobarbital. Methyl phenobarbital means compulsory in that structure we have methyl group. Okay, that is an important point in that structure. So what is the another name for methyl phenobarbital, mephobarbital? So what is the IUPAC name for this? 5-ethyl, 1-methyl, 5-phenyl, barbituric acid. Next, mephobarbital is a strong sedative with anticonvulsant action, mild hypnotic. It is used for the relief of anxiety, tension, apprehension, and is an anti-epileptic in the management of generalized tonic, clonic, and absence of seizures. Next, coming to the next one, amylobarbital or amylobarbital. This is also one more important drug in this barbiturates. So in that barbituric acid is present, is nothing but barbital skeleton. Already you know that it is an 6-membered ring at 1/3 positions, 2 nitrogens along with 3 C double bond O groups present at 2nd and 4th and 6th positions. At 5th position, this is the side chain is present. Okay, what is the side chain name? Methyl butyl side chain is present. Okay, 5-ethyl, 5-methyl butyl side chain is present at the 5th position. Okay, so what is the IUPAC name? 5-ethyl. Ethyl means already you know that. Ethyl means this is the side chain. Ethyl means C2H5 group. Okay, next 3-methyl and butyl. Butyl means again we have 4. But means totally we are having 4 carbons. Okay, methyl, butyl along with barbituric acid means this one. Okay, so next a barbiturate with a hypnotic and sedative properties but not anti-anxiety. Next, coming to the adverse effects are mainly consequence of those related CNS. Next, coming to the butabarbital. Another name is butisol or another and one more name is secobarbital. Okay, all are same. Okay, this is the structure of butabarbital. So in this structure also barbituric acid is present. At the 5th position, butane 2-yle 3-5-ethyl group is present. So this is the side chain for 5-butane 2-yle 5-ethyl group is present at 5th position. So that's why we are called this is the structure of butabarbital. Butabarbital is a fast onset barbiturate with short duration of action. It treats severe insomnia and preoperative anxiety. Butabarbital has been detected in multiple biofluids such as urine and blood. It is potentially toxic compound. Next, pentobarbital. In this pentobarbital structure at 5th position ethyl and one more side chain is present. 1-methyl butyl side chain is present. Okay, what is the IUPAC name? Sodium 5-ethyl 5-1-methyl butyl barbiturate. So that is the IUPAC name for pentobarbital. It is used as sedative or hypnotic drug for the short-term management of insomnia and is a pre-anesthetic medication used in the treatment of strychnine poisoning. Administered intravenously for the control of certain convulsive syndromes. This barbiturate reduces cerebral blood flow and thereby decreases the cerebral blood flow. That's it. Next, coming to the metabolism of barbiturates. So, coming to the metabolism of barbiturates, these drugs are metabolized in the liver and forms less lipophilic compounds. These are mediated through glucuronide or sulfate conjugation. So in that first one is oxidation of substituents at C5 forms alcohols or phenols, that is called glucuronide. Next, second one, it undergoes oxidative and dealkylation at nitrogen. Next, third one, oxidative desulfation of two thiobarbiturates is more hydrophilic barbiturates, which is excreted through urine. Next one is SAR of barbiturates. Already you know that this is the general structure for barbiturate or barbituric acid. So at first and third positions we have nitrogens. At second, fourth, sixth positions we have C double bond groups. At fifth position substituents R5, R5 dash. Okay. So in this SAR, first point is SDD. On the basis of SDD values, barbiturates are divided into two classes. So in that we have two classes. First one is active class. Second one is inactive class. Under that active class, these are all the examples. First one is 5,5 disubstituted barbituric acid. In this second one, 5,5 disubstituted thiobarbituric acid. Third one, 1,5,5 tri-substituted barbituric acid. So these are all the examples for active class. Next, second one is inactive class. Under that we have again 5 types. They are inactive since they are not acidic. So attachment of alkyl substituent to the both N1 and N3 renders the drug non-acidic, making them inactive. Next, coming to the second one is lipid water solubility. So this is an second point in that SAR. Lipid water solubility or partition coefficient is calculated to find out whether the compound is active or not. Next, third one in that SAR, third point, the sum of the carbon atoms of both of the substituents at C5 should be between 6 and 10th to attain optimal hypnotic activity. Example is barbital. Barbital is ineffective than phenobarbital. So next, coming to the, this is some is also index of the duration of action. Next, coming to the fourth one is the greater the branching, more potent will be the drug. Next, coming to the fifth point in that SAR, introduction of a halogen atom into the C5 substituents increases potency. Next, coming to the next one, introduction of a polar substituents. Examples are hydroxy, amino group, COOH is nothing but carboxylic acid, etc. into the aromatic group at C5 results in decreased lipid solubility and potency. Next, coming to the acyclic hypnotic containing nitrogens is miscellaneous compounds. Under that, one of the example is meprobamate. So this is the structure of meprobamate. So carbon attached with the 4 groups. One is methyl group and second one is propyl group and next one is propane diol group. Diol means due to the presence of 2 OH groups in that structure along with the dicarbamate. So this is the IUPAC name, 2-methyl, 2-propyl, 1,3 propane diol, dicarbamate. It is used in the treatment of anxiety disorders. It is also a centrally acting skeletal muscle relaxant. Next, coming to the glutathione. So this is the structure of glutathione. In this structure, piperidine is the basic nucleus. Piperidine means it is a 6-membered ring system along with 1 nitrogen present at first position. Okay. So along with the 2 C double bond groups present in this structure. At this position, we have ethyl and phenyl group is present. Okay. 3 ethyl, 3 phenyl. Piperidine means already you know that this is the structure of piperidine. 2,6-dione. Dione means due to the presence of 2 C double bond groups in that structure. So this is the structure of glutathione. It is used as hypnotic drug to induce sleep without depressing respiration. Overdose is less likely to depress the respiration. Adverse reactions include generalized rash, rarely nausea. Some of these side effects may be due to the anticholinergic activity. Next, alcohols and aldehydes. Under that example is paraldehyde. Okay, this is the structure of paraldehyde. Paraldehyde, IUPAC name is 2,4,6 trimethyl. Trimethyl means 3 CH3 groups present in that structure along with the trioxane. Oxane means due to the presence of oxygens in cyclic structure. Okay, it is exclusively used in the management of hospitalized patients undergoing alcohol withdrawal. Next, aldehydes and their derivatives. Example is triclophos sodium. So this is the structure of triclophos sodium. So in that triclophos means due to the presence of 3 Cls along with P double bond O group. Sodium means in presence of Na plus. Okay, so this is the structure of triclophos sodium. This is the IUPAC name 2,2,2 trichloroethanol dihydrogen phosphate monosodium. It is used as hypnotic. So these are all comes under the miscellaneous drugs. And finally, thank you.